starts now.
Good evening and thanks for joining us. I'm Mark Mullen.
I'm Catherine Garcia. Well, we begin tonight with a statewide push to improve mental health services. This has been a key issue, especially after years of pandemic restrictions. Governor Newsom laid out his plan while visiting San Diego over the weekend.
It's unacceptable what we're dealing with at scale now in the state of California. Not only in terms of what's happening on the streets and sidewalks, but those that are suffering alone, those that are unseen in homes, in mobile home parks, on the streets, obviously, as well, in isolation. We have to address and come to grips with the reality of mental health in this state and our nation.
So the governor is asking lawmakers in Sacramento for a measure on the 2024 ballot that would provide billions of dollars to create new behavioral health beds at state-of-the-art mental health care treatment campuses. He's also calling for an update to the Mental Health Services Act to allow its funding to serve people with substance abuse disorders.
People's lives can be changed. Forget the cynics out there that say this is too big, we'll never figure it out. We can't save all these folks. That's not true.
So we talked to a local drug treatment doctor about what this expansion would look like and how it could impact San Diegans suffering from mental illness and addiction. He told us that traditional support is not good enough anymore, and we need more residential facilities to be able to take care of those who really need it.
We're not trying to silo somebody, in the desert. We're not trying to build some old world, psychiatric hospitals where people are permanently housed, but humanely integrating people into the services that they need, just enough of those services that they need, not too many, not trying to enforce things, but, using a 21st century approach to getting people on the medications they can in an environment surrounded by what they need. And that's scalable. Some people need a whole lot. Some people don't need very much at all in order to get back on their feet.
Dr. Dunford said when it comes to treating substance abuse, getting people access to medication is crucial, but if that's not available, rehabilitation and counseling can be just as important.
Methamphetamine right now, we don't really have an effective treatment for that. And I can tell you, it is the scourge of San Diego. It is the underbelly of the problem here of all these other conditions, because it causes a lot of behavioral problems. And people become uniquely unmotivated to want to ever get back and do anything again. And so that drug, in combination with the other things we tend to think about, is sort of the trifecta of the problems that we have. And at the end of the day, the real solutions aren't just getting people on medicines. It's not just getting them a house. It's giving them something to do that they want to do.
Dr. Dunford says the most frustrating thing is seeing people who want help but can't get it. He's often forced to turn people away because they don't have the beds. And for that reason, he says the governor's bond measure is long overdue.